So the role of the certified nurse midwife is we are nurse midwives, which are different than other kind of midwives that also practice in the community. So that means we are nurses. So all certified nurse midwives are registered nurses. And to be a certified nurse midwife, you would then complete a postgraduate degree, and some certified nurse midwives have a master's degree and some have a doctorate degree, depends on which program you go to. We are all considered advanced practice registered nurses, which is like a nurse practitioner. So that's kind of the best way to describe it. Our scope of practice is focused towards all women's health. So we take care of women throughout the lifespan, from the moment you menstruate or before, all the way through menopause. What you really think about often when you hear about a certified nurse midwife is you think about delivering babies. But of course, yes, we do deliver babies. In the locations where we deliver babies, a certified nurse midwife can deliver babies at home. They can deliver babies in a birthing center or in a hospital. Now, in our state and our region, most certified nurse midwives practice in the hospital. Women that choose a certified nurse midwife typically choose that that provider when they want to have maybe more relational care or go unmedicated and have more of a low intervention birth. So that kind of sums up our role. We take care of you, like I said, through the lifespan. We do prescribe medication, birth control, take care of you all the way through menopause, and we do deliver quite a few babies.
Yeah.
Too, so,
I think women's health overall, I think we both have a passion for women's health, and we love, for me, I'm not a nurse midwife, nursing, but just fell in love with the whole process. And so as I have friends and great friends who are midwives in another profession, it is something that you have a passion about, women's health. And so that's what pushes you through there. Do I have a particular story, a particular something? No, but just having, and then eventually having my own children and doing all those wonderful things with my kids and seeing the birth of friends and family, you would just be part of that. And so that's why we do it every day. But why we became it is something that we just done.
Yeah, that's a lot. Yeah, it is a big misconception for the community, obviously, on what we do, because a lot of people are not aware that we do take care of other things other than delivering babies. So my typical day, depending on where I'm going to be planted that day, but if I'm in the clinic, I could do prenatal visits, I could do well woman exams, family planning, or problem visits, women that come in that are having gynecological problems. Now, we are not surgeons, so we don't perform surgery. We don't perform C-sections, so we collaborate with our OB-GYN colleagues who we love dearly, and we coordinate that care. If we identify that this is a surgical case, then we would refer that to one of our colleagues for care. So the days can be very busy, obviously, but our clinic appointments tend to be longer than what you would see with our OB-GYN colleagues.
Why is that?
We focus really on the relationship with that woman a lot. So that's our primary focus. It doesn't take very long to really perform a physical exam. So we're really trying to get to know her as a person and help meet her where she needs to be met, whether she's pregnant or not pregnant. So our appointments are always 30 minutes long. You get a 30-minute slot. And if it's your first appointment and you're pregnant, it's a whole hour. So we spend a whole hour with that woman just to establish a rapport and get to know her whole person. So I believe women seek midwifery for that reason and other reasons, but that they feel like they have a connection. So there's a deep connection with that provider. Women come to us, this is another misconception, that want an epidural, and we offer that, and we actually are okay with that. If that's your birth plan and that's what you want, we're going to support you in that. So you hear midwife and you think, oh, I don't want to do that because I don't want to feel anything.
Yes, right.
And we're very comfortable with taking care of a woman that actually wants an epidural, but they really do love the relationship and we really also want to include, the father of the baby or the siblings. You might see in our clinic, 30 minutes is quite a long time where we have the mom lying on a couch rather than a gynecological exam table, and the children help listening to the baby, because that baby is going to be born into that family. And it's going to be the whole family is going to have this baby, not just this person. So women do choose that, and seem to be very satisfied with that kind of care.
And it carries over to the hospital environment as well as the birthing center environment, where the whole family is part of it. I would say the midwife, they are very good about making sure that everyone is part of the experience, not just the birth, but just the whole experience from the beginning to the end. I know, right?
Jesus had a
the
midwife.
Jesus and the biblical days, Bible days, for real.
Well, a lot of in modern times, in today's time, you'll hear that it's inventive or progressive, but really, if you think about it, it's going back, and it's going back to low intervention and letting the woman, her body physiologically birth the baby the way nature intended to birth the baby. So midwives are known for high touch, low intervention, but that doesn't mean we're not going to intervene. If there is a problem, we are highly trained to intervene in the problem, and if there needs to be an intervention, we will. I believe there's been a shift where more and more people do desire to go back to the more natural, to the low intervention. So midwifery is not new, but it's definitely becoming more mainstream and more of a choice women are learning by all different means, by their friends, social media, doing their, they've got a lot of information at their fingertips. Right. And as they learn that they have this option, more and more women are choosing to use midwives.
Recently, seeing a collaboration between the midwifery, our OB physicians, and nursing coming together for a high-risk patient who was a midwife patient, coming in, and just everyone, all hands on deck. She had a complication, but she was very low intervention as much as we could, like low intervention for delivery, was there for several days, supported with her family, and had twins, I believe. Yeah, she had twins. And then it took a turn after delivery. And so seeing everyone come together, then it became clinical really quickly, meaning we had to go do some interventions. We had to really work together. And then seeing that mom and that family was there too at the bedside, talking to them, and the nurses, the midwives, the doctors, all coming together stood out. And what stood out the most, that the patient came back probably about a month later with the babies and looked amazing. She looks amazing. Came back, and she was just so grateful for the care that she received from everyone. She loved her midwife. She loved her time. She loved the doctors, the nurses, and the babies were so healthy. And so that's why I do it. It's why we do it, is because it's the whole woman. It's the whole family. The mother came, the patient's mother came with her and was in tears. She wasn't even here. She was actually out of state, but heard the stories. We were on the phone with her, talking to her. I think even Carla, one of you all, talked to the mom while she was in that state of distress. And she felt calm being thousands of miles away. Then when she came in with the twins, with the mom, she was just crying at the front desk and hugged everybody. And it just gave me chills, because that was the whole experience. That's what we're here for, is to provide the experience and the love for the mom, the babies, and the family. And that's something for me. At where we are, it was amazing. It was amazing how we did that. So
I do have one story that just makes me proud of my team. I'm the lead midwife. I have 16 midwives on our team. And this story will probably always stick with me, but we had a young woman that was very disadvantaged. And they didn't really have transportation. And sometimes she would come to the hospital by ambulance for a checkup. Just to check on her baby. So it comes time for her to go into labor, and we all had a place in our heart for her. We really, wanted to help her as much as we could. And my midwife, I didn't even know that this was happening until after it had happened. So she had come into the hospital in labor by ambulance, and they wouldn't let the father of the baby come. And there was enough time for my midwife to go pick him up.
Wow.
So she left the hospital and went and picked up the father of the baby so that he could be there for the birth. And it just, that's something you'll see a midwife do that really, really reaches far and wide. And I love that story. And that's a really good story to kind of sum up the care that midwives can give. And everything was good. He was there for the birth, and nobody missed anything. And It was a happy story.
That true connection, I think, that the midwives give, and that it is just personal, and it's relative and relevant to the patient. We listen to them, they listen to them, and it's just an amazing experience when we're all come together. That's what kind of draws everyone to the midwives.
Yeah. So I do own the business, and so we've been practicing now the entire practice for about 13 years. We have 4 locations in the Metroplex. So Mansfield is one of our fastest growing locations that we've ever had. I predict that midwifery will grow stronger and stronger and be possibly similar to what we see in other countries. If you were to have a baby, let's just use Europe as an example, if you're low risk, you would see a midwife. That would be your normal care provider until you needed to see a doctor or a surgeon. I feel like it's trending towards a lot of our female OB-GYN colleagues are leaving their private practices and going in to be hospitalists. We're seeing more and more women that would not normally choose a midwife, but they really don't have anywhere to go. So I believe midwifery will be part of everyone's care in the next probably 10 to 20 years. We love working with our OB-GYN colleagues. We love collaborating with them in that way that we can help them too with the volume of just getting everybody seen. Well, I believe we have pulled it together.
I think so.
We work alongside our OB-GYN colleagues, so they're very involved and available to us because we cannot do what we do without them.
Right.
So that collaborative relationship is what makes it work. If you didn't have that intertwined collaboration, it wouldn't work the way it does. I do think that midwives and OB-GYNs moving forward will work more and more and more together.
I think as a profession, as we grow, I think we'll see more alignment that way. I think you have traditional colleagues of OB-GYNs who are very traditional based in their thinking and their mindset. And as that is evolving and changing over the years, and as the population of OB-GYN doctors are getting younger and women, and understanding that, that's where the collaboration gets better, the cohesiveness gets better. And so I think that's what I'm seeing, I've done it for a long time. It is changing and evolving to that, which is wonderful. Now, the very, very, very high risk patients who are things that, but they still can see them, but they also have it adjunct together with the providers like that, with the OB physicians. And so seeing that, being part of it for so long, it is getting better. The lines are getting less and less between them as we work together in the hospital setting. In the birth centers, they're beautiful in the birth centers. They can stand alone and are alone, and then come to the hospitals for those high risk things or things that they cannot just have in the birth center, they have in the hospital. But we still do everything we can to allow that experience for the mom and the baby and the family. So I think as years come, at the hospital.
So
we don't do home births in our practice. Most nurse midwives you'll see working in the hospitals. We do have a freestanding birthing center in Fort Worth. So we did over 1,000 deliveries last year. 200-300 in the birthing center. The rest of those were in the hospitals. So women come to us, choose where they want to birth, whether it's in the hospital or at the birthing center. The hospitals that we're associated with tend to lean more towards supporting natural birth and allow for options for women. And to me, it's a very safe thing to do if you're going to choose to have a low intervention birth, to do it in the hospital where you have that safety net as well. It makes sense, right? So the facilities we're aligned with do have a culture that leans towards, allowing women to ambulate during labor, push in any position that they want to, labor in the water, eat and drink. These are all of the things that if they desire a natural birth that are important to the woman, and that's why they choose midwives, and that's why they choose to deliver at these facilities that have midwives.
And it's grown over the years, right?
Sure.
Because years and years ago, you couldn't eat, or you couldn't have to be in the bed in one position and labor that way. And so it has evolved into where it is now the choice of the mom. And we give them that support that education to know that they have that freedom. And then where we are, we can allow that for the families as well. So I know it has evolved over time since I was a nurse and started out.
Same with me.
Same thing. And so, together. So we just know that it's over time, it has evolved. And so the midwife has been a part of that. It's been the crux of that because we have been able to do that because of their support. So it's been pretty amazing. I think as the maternal morbidity and mortality rates in Texas we're on a rise, right? And so particularly in African American women. And as social media has been a good and bad for all things. And so seeing that and having that in your forefront, and that we have an option where someone is listening to my choices and giving me the options and then giving me an intelligent answers, like not just the textbook things that should happen, but what are my options? What can I do? What can I not do? Tell me what that is. I think having that midwifery nursing touch allows them to have that open dialogue with their providers. And so that has helped tremendously. Now, are we where we need to be? No. But the awareness that patient, that mom, African-American mom at that, has an option to do either one. For so long, they didn't think that way. And if you think way back in time, they had lay midwives way back, right? Mm-hmm. And their grandmothers or great-grandmothers were born that way by lay midwives. And then as it's evolved over the years, became more sterile when it comes to the hospitals and those things, because in their mindset, you think that's where it's supposed to go. But now it's kind of going back to the family and to the options and what options we have for each other. What I have for my children, for me, for my sisters, and all those great things. So I think as that has given us some options, it also helped with the awareness. And then also the midwife supports us 100%.
You know,
That's
it's
really what we
interesting
try
as
to
you
do.
say that.
And just to expand more on what LaTosha was talking about, we know this, and we are very inundated in the data, and the scientific evaluations of our outcomes. And I think we live in the United States with the best technology in the world when it comes to healthcare, with the most expensive healthcare in the world as well. We have the poorest outcomes, especially for maternal child health. So we're at the very bottom of the totem pole, and that's, to me, frightening.
It's frightening, scary,
and not okay. So our group is definitely focused on making a difference there, and taking care of vulnerable populations and women of color, and really making an impact on maternity outcomes. If you look at other countries that have much better outcomes than us, midwives are seamless in the care. Every time. And you have to think sometimes, are we doing things to cause this? Like maybe too many inductions or too many C-sections. Where's the breaking point? And I think midwives really do have a role. And I think the hospitals are starting to see that. Insurance payers are starting to see that. Political bodies are starting to see that, and just in the 13 years I've been doing this, I've seen big changes that are good and healthy for women and babies, and that's important.